Hello, this tutorial is on the typical cervical vertebra anatomy. This is the fifth cervical vertebra. We're looking at it from an anterior view. So my pointer is on the anterior part of the vertebral body. Now my pointer is on the superior part of the vertebral body where a vertebral disc would sit, and then the fourth cervical vertebra would sit on top of this vertebra with the vertebral intervertebral disc in between. Now let's turn it laterally. Actually, let's look at the transverse processes. We have the right and left transverse processes projecting laterally from the vertebral body itself. If we oblique the vertebra, we can see that there is a foramen in the transverse processes. This is called the transverse foramen. These transverse foramen, they serve as passageways for blood vessels and nerves. Let's turn the vertebral body laterally so we can look at the angle, because it's important for us to understand that the cervical vertebra sit at an angle. So where the intervertebral discs lie between the vertebral bodies, there's about a 15 to 20 degree angle that the vertebral body makes. So the vertebral bodies of the cervical spine angle anteriorly and inferiorly 15 to 20 degrees. This is why we use a cephalad 15 to 20 degree cephalad central ray for our AP cervical spine views. Now, if we look at it a little bit obliqued, we can see this structure of bone projecting directly off of the vertebral body. This is called the pedicle. The pedicle. It projects directly from the vertebral body. Now, working our way more posteriorly, we see these two processes projecting superiorly and inferiorly. These are called the articular processes, the superior articular process, and the inferior articular process. When the vertebrae stack together, these articular processes will articulate between the different vertebrae and create what's called the zygapophyseal joint or the apophyseal joint between the vertebrae. Working our way more posteriorly, we have on the right and left side of the vertebra the laminae, the right lamina and the left lamina. These laminae project posteriorly and they help to form what's called the vertebral arch. The vertebral arch, the lamina forms that more posterior part of the vertebral arch. Then the vertebral body helps to form the more anterior portion here that encloses the spinal canal. This is called the vertebral foramen. Vertebral foramen, not to be confused with the transverse foramen. Transverse foramen. Now, the spinous processes of the typical cervical vertebra are different in that they are called what they call a bifid split tip. So as we talk about the different vertebra, the lumbar vertebra and the thoracic vertebra, you will note that the spinous processes do not have this bifid tip split in the spinous process. Now, I wanted to talk about the pedicle a little bit, because if you look at the pedicle here, where it's projecting directly from the vertebral body, it forms kind of like a U shape here, right? So, and then we also have a pedicle inferiorly. So, I mean, we have the pedicle projects from the vertebral body, but we have this little U shape superiorly and a U shape post inferiorly here, and those are called the vertebral notches. So we have a superior vertebral notch and an inferior vertebral notch, and it's kind of hidden behind this transverse process because of the way the transverse process projects laterally and a little bit inferiorly there. But that U-shape notch from the inferior part of the pedicle here, right? This would be the inferior notch, and this would be the superior notch. So where the vertebrae stack together, these notches form a hole called the intervertebral foramina. So if I can put some of it, let's put the spine back, see if I can kind of zoom in here some for you to try and show you those zygapophyseal joints and the intervertebral foramina. So where these two vertebrae, where this vertebra meets with this vertebra, here's the inferior articular process of this vertebra. This is the superior articular process of this vertebra. All right. This just happens to be the second cervical vertebra, which is not a typical vertebra. It's a little bit different, but it does have the inferior articular process articulating with the third cervical vertebra with its superior articular process. That joint there is called the zygapophyseal joint or the apophyseal joint. Now we'll have to oblique the patient to try to find those intervertebral foramina. Now I can see the superior vertebral notch happening where I've highlighted this bone here where it's blue. You can kind of follow it. This transverse process of this vertebra is kind of hanging down over it. But we can see that superior vertebral notch. If I tilt them up a little bit, we'll see it better. Here's the superior vertebral notch formed by the pedicle, right? Now, this superior vertebral notch will articulate with the inferior vertebral notch of the pedicle above it. And where they fit together, those U shapes form a hole called the intervertebral foramina. So we can kind of see a little bit of it here. But this also, looking at it like this gives you a good idea of how when we look at our x-rays, these structures are going to superimpose each other on our x-rays, right? So we do an oblique x-ray to see those intervertebral foramina. But we also have to put a cephalad angle on the tube, that 15 to 20 degree cephalad angle on the tube to pass through those intervertebral foramina properly because of that natural 15 to 20 degree anterior inferior angle that the vertebral body makes. So just some things to keep in mind when you're looking at the x-rays. You'll have the intervertebral foramina will be there, but look at what's hanging down in there. What's kind of hanging over it is the transverse process and that transverse foramen, which is yet another hole. So we don't want to get, so we'll be looking specifically for this where these notches are coming together, but remembering that that transverse process is also there with the transverse foramen kind of superimposing into that area as well. So, we're going to be looking at these structures very closely and identifying what structures we can see in what, depending on what specific x-ray it is that we've done to see those specific structures. So we can see how the vertebrae stack together. There's no intervertebral discs here, for us to see, but we can see the zygapophyseal joints, remembering that that column of bone between the superior and inferior articular processes is called the articular pillar. Transverse process out laterally, the pedicle that projects directly off the vertebral body. Posteriorly, we have a more flattened portion of bone here called the lamina that helps to form the vertebral arch posteriorly where the spinal cord will go. And then those spinous processes have a bifid split tip. So maybe we could fade a little bit, make it look a little bit more like an x-ray. If we fade some of these out, right, and kind of turn them around, try to make it look a little bit more like an x-ray and turn it around. Now we can see those, those intervertebral foramina trying to show through here, but then also those transverse processes hanging down a little bit in the way because we don't have we're unable to angle, so we have to angle the patient up a little bit like this. We can see that superior notch there helping to form that intervertebral foramina. So I hope that this was helpful. Stay tuned for more on the vertebra C1 and C2 anatomy. Thank you for watching.